The Medical Reserve Corps was started post 9/11 to supplement the infrastructure for disaster response. Anything that they might need during a disaster, food services, pet sheltering, there's a whole array of things that the Medical Reserve Corps can do. The Medical Reserve Corps also is there to supplement public health preparedness along with public health outreach. Certainly public health preparedness, we're trying to get information out to the public, what to do in a disaster, how to access resources. Also with public health outreach, we're trying to promote immunization, healthy lifestyles, and things like that. So those are a lot of the opportunities that the Medical Reserve Corps can offer. Our Medical Reserve Corps has staffed, managed, and supplemented shelter staff during the ice storms of 2007. They also were deployed down to Haiti to help with the mobile hospitals. We also aided with Hurricane Wilma and Katrina and Ike. Most likely there is a job for any volunteer to help out during a disaster. This is actual hands-on. You get to meet your neighbors, you get to help your neighbors, you get to give back to your community, and it's truly boots on the ground community work, and it's a wonderful opportunity.
We have a core group of volunteers, and then we can use them for whatever we feel the need is. So if there was a need to set up a shelter, our people would be trained. We would be able to need people who can run a database. We need people who can man a telephone. So it's not just medical people that we need. We need all kinds of people with different skill sets. I have an IT background, but I think my organizational skills are what keep me in the job that I'm doing.
If you want, I can have them printed and send them out, but we do have a list of members that don't have emails, and I really need to do some outreach with them because they don't feel incorporated at all.
Normally, there's a sheltering component, so I think we still need to go with the sheltering.
What's
What
the
are your
incident?
thoughts?
We need
The
an
incident.
We need an incident. Power failure or an ice storm. Ice storms are frequent in this area. There's a massive power failure, and we have an elderly home that does not have a backup generator. Those people have to be moved to someplace warm.
Incredible amount of resources that were put forward to handle these issues, and a lot of it's the planning, the drilling, the EMS, local emergency management, state emergency management, health departments, everybody does that is responsible. What we're realizing a lot of times with sheltering is a lot of people that end up in the shelter are those underserved populations that need assistance. What you do is to get to know everybody in your group, read your scenario, and discuss how you would handle the situation, and then choose a spokesperson to take down.
You can expect information from
So I'm not really sure how this works. You'd like to have a one-on-one, possibly, with registration. If you know the police are coming in, the police might know this person, so get...
Thought one strategy might be a community meeting that was designed both to hear concerns and validate people's experiences.
They're basically used to identify people when they go to an event. And on the back we print that these people should be allowed to be given transportation. They've been activated in an emergency.
Dr. Cruz is also a driving force behind the American Medical Association's Doctors Back to School program.
And so that the public has to be educated about a lot of different things in terms of patient empowerment and healthcare literacy. But the piece of it is what is our role in terms of making sure that community health is at the forefront of every single agenda. And because we care about the common good of the people in our society, what does it mean to really care about the health of a total community and move everyone?
Yellow is fast track, green is main lobby. So those patients that are determined to be evacuated will be evacuated to us.
Paper statement, and
this is a drill. This is Incident Command. Just so you know, our temperatures are rising. We have no updated report regarding when the power is going to be back up. Over. Let's expect the worst and hope for the best. That's when we get it.
This is a generic, right out of the book form. It's not the Catechism, it's not the Creed, it's not the Ten Commandments. It can be modified to suit.
Hi, my name is David Hunt. I'm with the Woburn Medical Reserve Corps. Drilling is important because you don't know what can go wrong during a real emergency. In cases like this, it shows you what can go wrong and how to deal with it before an actual emergency does happen. I'm proud to be part of this drill and this organization and encourage others to join.
Volunteering obviously has a lot of intrinsic value. There's a lot of reward just knowing that you are doing something inside your community, that you're really making a difference, and hopefully helping anyone in the event that anything were to happen, and know that your city and yourself and your family and your friends are going to be safe. We've done a lot of work with press releases, getting prospective members involved and understand exactly what the MRC stands for, and met a lot of people throughout Woburn and a lot of very influential people that will obviously be able to really help with the MRC's mission and values, and really help in our own personal lives as well.
The best part of what we do here typically is getting the information from you, the participants, the players, the role actors that help serve as our patients, because this information is critical to us when we go back and we create what's known as an after-action report/improvement plan.
And what they were doing, in that they didn't approach the table with many small detailed questions or issues or concerns. They went up to their chain of command, allowing this table and their staff to do what was necessary, which was manage the incident.
As far as constant questions being asked by those attending to the injured and so forth, and everything was just click, 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 and it was perfect.
If we're evacuating patients there, they should know that they're coming.
And that was at Melrose Wakefield? Yeah. Okay. It touched on all the really key points. General safety message, safe, calm evacuation, qualified staff, very good plans, a lot of good support personnel. So what did they give the public? A reassuring sense of there's nothing wrong here, everything's fine.
I serve as a non-medical person on the MRC, assisting as I can in flu clinics and other operations. But really the MRC is, to me anyway, is kind of like a fire insurance or a car insurance policy. You hope you never need it, you hope you never have to file that claim, but it helps you sleep a little bit better at night knowing that you've got it. It requires a bunch of dedicated volunteers who know what they're doing, who know how to respond to an emergency. The MRC is the place to be. You don't have to be a doctor, you don't have to be a nurse. You can be just a layperson. You can help out with forms, with crowd control, with access, with orientation, with just being there to offer a helping hand to folks in times of emergency. And you know, if you want to help your community, this is a great way to do it.